What are your thoughts on medically assisted death? Bozo said. My hip is hollowed out from vascular necrosis, so I kind of feel your pain. I worked with, knew and know countless veterans who suffer from painful degenerative diseases, who'd like to go gracefully on their own terms. Dr. Kevorkian was ahead of his time. WT What said. Terry Pratchetts shaking hands with death is an excellent talk on this. https://www.youtube.com/watch?vicwills90b1mbwnehm. Also, Who by Very Slow Decay by a different author. When you were young, you would go to institutions and gradually gather letters after your name, BA, MD, PhD. Now that you are old, you do the same thing, but they are different institutions and different letters. Your doctors will introduce you to their colleagues as Mary Smith, COPT, PVD, ESRD, IDDM. With each set of letters comes another decrease in quality of life. At first these sacrifices will be minor. The COPT means you have to breathe from an oxygen tank you carry around wherever you go. The PVD will prevent you from walking more than a few feet at a time. The ESRD will require 3 hours dialysis in a hospital or outpatient dialysis center 3 times a week. The IDDM will require insulin shots after every meal. Not fun, but hardly inconsistent with a life worth living. Eventually these will add up beyond your ability to manage them on your own, and you will be sent off to a nursing home. This will seem like a reasonable enough idea, and sometimes it goes well. Other times it gives you freedom to develop a completely new set of morbidities totally unconstrained by what a person in any other situation could possibly be expected to survive. WT What said. You will become bedridden, unable to walk or even to turn yourself over. You will become completely dependent on nurse assistants to intermittently shift your position to avoid pressure ulcers. When they inevitably slip up, your skin develops huge incurable sores that can sometimes erode all the way to the bone, and which are perpetually infected with foul-smelling bacteria. Your limbs will become practically vestigial organs, like the appendix, and when your vascular disease gets too bad, one or more will be amputated, sacrifices to save the host. Urinary and fecal continence disappear somewhere in the process, so you're either connected to catheters or else spend a while every day lying in a puddle of your own wastes until the nurses can help you out. The digestive system isn't too happy either by this point, so you can either have a tube plugged directly into your stomach or just skip the middleman and have an IV line feeding nutrients into your bloodstream. Somewhere in the process your mind very quietly and without fanfare gives up the ghost. It starts with forgetting a couple of little things, and progresses until you have no idea what's going on ever. In medical jargon, healthy people are alert and oriented X3, which means oriented to person, you know your name, oriented to time, you know what day, month, year it is, and oriented to place, you know you're in a hospital. My patients who have the sorts of issues I mentioned in the last paragraph are generally alert and oriented X0. They don't remember their own names, they don't know where they are or what they're doing there, and they think it's the 1930s or the 1950s or don't even have a concept of years at all. When you're alert and oriented X0, the world becomes this terrifying place where you are stuck in some. WT What said. Kind of bed and can't move and people are sticking you with very large needles and forcing tubes down your throat and you have no idea why or what's going on. So of course you start screaming and trying to attack people and trying to pull the tubes and IV lines out. Every morning when I come into work I have to check the nurse's notes for what happened the previous night. And every morning a couple of my patients have tried to pull all of their tubes and lines out. If it's especially bad they try to attack the staff, and although the extremely elderly are really bad at attacking people, this is nevertheless unacceptable behavior and they have to be restrained, i.e. tied down to the bed. A presumably more humane alternative sometimes used instead or in addition is to just drug you up on all of those old-timey psychiatric medications that actual psychiatrists don't use anymore because of their bad reputation. After a while of this, your doctors will call a meeting with your family and very gingerly raise the possibility of going to comfort care only, which means they disconnect the machines and stop the treatments and put you on painkillers so that you die peacefully. Your family will start yelling at the doctors, asking how the hell these quacks were ever allowed to practice when for God's sake they're trying to kill off grandma just so they can avoid doing a tiny bit of work. They will demand that doctors find some kind of complicated surgery that will fix all your problems, Add on new pills to the 13 you're already being force-fed every day, call in the most expensive consultants from Europe, figure out some extraordinary effort that can keep you living another few days. Robin Hanson sometimes writes about how healthcare is a form of signaling, trying to spend money to show you care about someone else. I think he's wrong in the general case. Most people pay their own health insurance, but I think he's spot on in the case of families caring. W.T. Fuzzipants said. For their elderly relatives. The hospital lawyer mentioned during orientation that it never fails that the family members who live in the area and have spent lots of time with their mother, father, grandparent over the past few years are willing to let them go, but someone from 2,000 miles away flies in at the last second and makes ostentatious demands that everything possible must be done for the patient. Your doctors will nod their heads and tell your family they respect their wishes. It will be a lie. Oh, sure, they will carry out the family's wishes, in terms of continuing to provide the care. But respect? In the cafeteria at lunch, they will, despite medical confidentiality laws that totally prohibit this, compare stories of the most ridiculous families. I have a blind 90-year-old patient with stage 4 lung cancer with brain mets and no kidney function, and the family is demanding I enroll her in a clinical trial from Sri Lanka. Oh, that's nothing. I have a patient who can't walk or speak who's breathing from a ventilator and has anoxic brain injury, and the family is insisting I try to get him a liver transplant. Every day, your doctors will meet with your family another time, and eventually, as your condition worsens and your family has more time to be hit on the head with the big club marked reality, they will start to relent. Finally, they will allow your doctors to take you off of the machines, and you will be transferred to palliative care, whose job I do not envy, even though every single palliative care doctor I have ever met is relentlessly cheerful and upbeat, and this is a total mystery to me. And you will die, but not quickly. It takes time for the heart to give up, for the lungs to fill with water and stop breathing, for the toxic wastes to build up. It is generally considered wise for the patient to be on epic doses of morphine throughout the process, both to spare them the inevitable pain as their disease takes their course and to spare their family from having to watch them. W.T. Fuzzipants said. Not that they always do. It can take anywhere from a day to several weeks for someone to die. Sometimes your family wants to wait at the bedside for a week. But a lot of the time they have work and things to do. Maybe they live thousands of miles away. You haven't recognized them in years, you haven't spoken a coherent word in months, and even if for some reason your brain chose this moment to recover lucidity, you're on enough morphine to be well inside the borders of La La Land. A lot of families, faced with the prospect of missing work and school to sit by what's basically a living corpse day in and day out for weeks just to watch it turn into a non-living corpse, politely decline. I absolutely 100% cannot blame them. There is a national volunteer program called No One Dies Alone. Nice people from the community go into hospitals to spend time with dying people who don't have anyone else there for them. It makes me happy that this program exists. Nevertheless, this is the way many of my patients die. Old, limbless, bedridden, ulcerated, in a puddle of waste, gasping for breath, loopy on morphine, hopelessly demented, in a sterile hospital room with someone from a volunteer program who just met them sitting by their bed. Pascork said. I'm not suicidal or depressed at all. And this shouldn't be taken as advice or anything. Having said that, if I ever get diagnosed with some form of dementia, Alzheimer's or whatever, I really hope I still have enough brain power left to order a big bottle of an inner gas, preferably one of the heavier noble gases, and a mouthpiece attachment. Worst case, a plastic bag or enclosed space. From everything I've read, oxygen asphyxiation is by far the least painful way to go. I've seen multiple people go through dementia, including my grandma. It just sucks for everyone involved. Can only hope to go like my other grandma. Healthy, mobile and lucid as anyone. Living independently alone, one day at 93 had a brain aneurysm. Found her sitting on the kitchen table. She probably didn't even notice she died. I at bedtime yet said. I feel this. I watched my dad die in front of my eyes from dementia. He went from a strong, proud man to a fifth vegetable. It was incredibly traumatic to be a part of his transition. Making all of his care decisions took such a toll on me, and all the while, I was thinking of how, in his right mind, he would be mortified of what he had been reduced to. He actually died of COVID, in a crappy care home, alone. If ending his life could have been on his terms, I know we could have been there with him. It's a year on and I'm still so pissed at the way we treat people with late-stage dementia in the UK. Ben E. Hadron said, "We let people die in fear and pain, but not animals. The last 6 months of my mum's life were exactly how she didn't want to live, confused, incontinent, immobile. I longed for there to be a legal way to end her suffering. She made it very clear to me during her life that this was not the way she wanted to go. I'm an RN, and should make it clear I've never assisted ending anyone's life, but I've wanted to. Medically assisted death doesn't mean more death, just less suffering." Hemlettle said, "Yeah, same here. Mom had stage 4 cervical cancer and ended up with a large brain tumor as well, within the last 2 weeks of her life. She went out how nobody should have, in constant pain, immobile, incontinent, and just completely brain dead. You could see the glaze over her eyes. The last 2 days of her life was her being completely despondent outside of her having whole body shakes due to pain. It was fucking heartbreaking to watch her go out like that. I desperately wish that medically assisted death was a thing in that moment. I still do. No one should go through that." Farsi 2223 said, "My grandfather had a massive heart attack followed by a stroke and then a coma some years ago. He was very verbal that he did not want to live past his usefulness, i.e. do not keep him alive if he can't function on his own. His mother and sister were not willing to let him go, so he was kept alive on fluids and ventilators and tubes for months. He had to have said fluids pumped out periodically bc his kidneys had shut down and he couldn't eliminate them from his body. His skin turned yellow, and was so full of fluids that if you pressed on his arm, it sunk in and didn't reinflate itself for several minutes. It was horrible. Even when the doctors said, 'Look, he's never going to wake up,' they refused to let him go or sign a DNR, do not resuscitate. So the doctors actually brought him back from death 3 times. I hate that my last memories of him are his bloated yellowing body in a hospital bed, blood mixed in with his urine in a big to the side of the bed, and not even being able to touch him or talk to him. That was absolutely not what he wanted at all and not what he deserved. He knew his body was shutting down before the heart attack and he knew he was sick. If it had been legal he could have passed quietly at home with dignity like he wanted." Femislove said, "This is exactly what it was like watching my grandma pass away a month ago. She just suddenly started losing all motor and cognitive functions. To see her become a shell of herself and just not there anymore is so sad and heartbreaking. She couldn't open her eyes or her mouth and we were just watching helplessly and changing diapers when need be and listening to her in pain. No person or family should have to go through that." Radioactive Cat 37 said, "As a veterinary professional, I totally agree with you. Yesterday was euthanized a cat with excruciating hip pain, looked like there was bone cancer in there or extreme osteoarthritis. The radiographs scared all of us. The owner elected for that because there was no way we could control this level of pain without hospitalization long term and she wanted to spare her cat as much suffering as possible and let her go with dignity. But then we leave humans to suffer and die without any dignity at all. I watched a documentary on Netflix about childhood cancer and the last moments of some of them was heart-wrenching. Just let them go before they suffer to the extreme." Babadoo said, "This is so true. In 2019 I lost my 12-year-old cat and my grandma, both from sarcoma. And the dualism in medical approaches bothered me so much. For my cat, as hard as it was to make the decision, looking back it was the right call because she was in so much pain and there was no getting better. But my grandma had to slowly wither away in a hospital in a state that can hardly be called living. She was just surviving connected to machines. And we are capable of making decisions, so each of us should be able to choose if we want to hold on or let go." Gizmo said, "Like Christopher Hitchens so succinctly put it, religion poisons everything. I bet there are profoundly cogent theologians, inside their convoluted framework cogent, that is, who would argue why a human's life is especially important to prolong to its last agonizing second, while a mere animal, probably regarded as soulless, can be euthanized in dignified mercy. To me it's one of the most wicked concepts imaginable. You are declared as not mundig, to choose ending your own life with dignity because it curtails the religious supremacy of some band of delusional fuckheads, who time and time again have shown that their supernatural concepts are based in obtuse dogma yielding immense pain and suffering for whomever they declare power over. Needless suffering fetishized in some sense of providential self-flagellation to gain perverse closure to your tortured superhero on the cross. Mundig is a German term in philosophy, Kant's Enlightenment, which AFAIK doesn't have a full equivalent in English. In some form it's mature, as in, ripe enough to make own important decisions, but more in an emancipation sense. Habermas called it authorship over your existence. Lauren 12269 said, I'm not going to kick the bucket anytime soon, just saying. I just turned 39. I view my greatest achievement as coming out of an insanely traumatic childhood as a surprisingly undamaged person who has not made the same mistakes my parents made. I don't live my life with regret. I learn from things and I move on. I don't dwell on them and punish myself. I appreciate the small things in life. Enjoying reading a great book, watching Bob's Burgers, spending Father's Day with my dad, reconnecting with my estranged mother and helping my sister understand I could not have done this without her. I tell other people in a situation like mine to be your own advocate. Always speak up for yourself. Don't apologize when you're upset. If you need to cry, do it. If you're overwhelmed, no problem. These feelings are intense and your own. This shit is intense. I hold nothing back and I'm not sorry about it. Das Fuzzipants said, my grandmother passed away last week with a medically assisted death. She had cancer that had spread to her brain, and was given a few weeks to a few months to live. From what family members said, she was deteriorating fast. She made the decision to have the procedure done as she wanted to end her time here with dignity. The appointment was made, doctors consulted, and paperwork drawn up. 10 days later 2 medical professionals came by her house where she was spending time with her children. It was done quickly and comfortably. Nana left peacefully on her own accord, in the comfort of her own home, and while she was still more or less herself. It was very strange to have a time and a date looming, but it also allowed me to set aside that time to be alone and hold a small vigil of my own. I'm currently in another country, and couldn't get back. She lived in Canada, where this service has recently been made more accessible, and I'm all for it. If it helped my Nana, it could help so many others. Alcaps hashtag said, I can only speak for Belgium. I don't know exactly why or how it grew this way. It has to do with the way euthanasia is defined legally here. It's an exception on the laws against murder, which means that a doctor who doesn't follow all precautions might get on trial for murder. Only recently there was a huge trial with 3 doctors after the family of the patient sued them. The patient got euthanasia for unbearable mental suffering, which is legal here since a couple of years, but the family argued that not all criteria had been fulfilled or something. Don't remember the exact details. Anyway, personally I'd like to see assisted suicide and euthanasia both legal, but I realize we're already very progressive in this regard and that in most countries this topic is still taboo. Fang Fluff said, this is what I feel makes this procedure something that should be fully available everywhere, knowing when it will happen. I feel that the knowledge that it absolutely is going to happen at this specific time on this specific day would help so many people process it better. My granddad has brain cancer and has been given 3-6 months, but it could be longer, it could be tomorrow, we don't know for sure, and it's horrible. It would definitely help me process the whole ordeal if he would take this option, if he wanted to of course, and I would have time to come to terms with it, and overall I think I would be in a healthier place mentally myself. WTF what the hell said. That's apparently depressingly common. Case 1. Mary is an elderly woman who undergoes a surgery known to have a painful recovery process. The surgeon prescribes a dose of painkillers once every 6 hours. The painkillers last 4 hours. From hours 4-6, Mary is in terrible pain. During one of these periods, she says that she wishes she was dead. The surgeon leaps into action by calling the on-call psychiatrist and saying, hey, there's a suicidal person on my ward, you should do psychiatry to her or something, I am the on-call psychiatrist. After a brief evaluation, I tell the surgeon that Mary has no psychiatric illness but needs painkillers every 4 hours. The surgeon lectures me on how there is an opioid crisis, you know, and we can't negotiate with addicts and drug seekers. I am a consultant on the case and can't overrule the surgeon on his own ward. So I just hang out with Mary for a while and talk about things and distract her and listen to her scream during the worst part of the 6-hour cycle. After a few days the surgery has healed to the point where Mary is only in excruciating pain rather than actively suicidal, and so we send her home. Aligerol said, my grandfather died of cancer. It was horrific. It rotted his body. turned him into a shell of a man. I remember sitting with him one day as he lay with his faithful Alsatian. He looked at her and said, "I wouldn't put her through this. Why do they make me suffer?" Then he kinda just went silent, and stayed like that for the remaining several weeks. But you could see the tears rolling down his face. My grandmother had dementia, and I think that was a saving grace. She got stuck in a sort of time loop the last few weeks of her life. She went back and relieved the day my grandfather came home from war. He took her out dancing that night. I've always looked like my great-aunt Rita, grandfather's sister, and she addressed me as Rita for months. It was like she forgot she was an 85-year-old lady. She was a young woman again. I honestly think that was the only decent thing about the dementia, sticking her in a time loop she was unaware of. Several years ago I had an accident and broke, among other things, my back and neck. I had to be kept immobile for several days while the swelling went down. I unfortunately also had a severe allergic reaction. I was told to prepare for the worst. That I may be left paraplegic from the neck down. Those FRW days felt like a millennium. And I instantly knew that if that was the outcome, then I was not going to live like it. I was always too active to live my life looking at the ceiling or in a chair with only the use of my face. Unfortunately, that isn't an option in the UK, and it was my best friend who said, "Don't worry, your animals will be taken care of and you will have a pain-free accident within a week of being out." And although I am actually okay, still get a fuck ton of residual pain in my neck, I made pretty much a full recovery. I'll love that woman forever for that sentiment. I'm all for assisted death. Not just for terminal illness, but where I would be miserable and a burden. And trust me, I would make everyone around me miserable. And I would be miserable. Where Gray said, "I just went through this with a good friend in Canada. He had a glioblastoma, and was given 3-6 months to live. Ultimately he lived for 15 months, but he wanted to be sure he could end his life when things got bad for him, so he made the necessary preparations. I'd long known he'd made these plans. I wasn't sure how I felt about it. But as I was caring for him for the last 6 weeks of his life, I got to witness the process firsthand. Long story a bit shorter, towards the end my friend could no longer walk or speak. He could understand everything you said to him, but he couldn't find the words to reply intelligently. In his frustration he made it clear that he was ready. So we explicitly asked him if he was ready to die. He said yes. The next day 2 nurses came to his home. They talked to him and confirmed that he wanted to end his life. So, while sitting in his favorite recliner, they put in an IV. His immediate family and I sat with him. The nurses administered medication that made him fall asleep. Then they administered a second medication that stopped his breathing. In less than 5 minutes he was gone. I don't know if I'd have the courage to make the decision my friend did, but I didn't experience his suffering. Being present for him as he ended his life has convinced me that having the option to end your life on your own terms is the absolute right thing to do. There's no reason someone should have to continue to suffer when they know all they have to look forward to is more suffering. I'm very grateful that my friend had the option available to him. Had he been in my state in the US, that wouldn't have been possible. But it should be. Library Lulu said, "My mother had a series of strokes that left her almost totally paralyzed other than her left hand. She had brain damage that meant she couldn't tell reality from dreams, so a nightmare would become real to her, leaving her terrorized for days. She was also blind and nearly totally deaf. She suffered like that for years, getting great care, being fed boiled dog food, crying and begging for it to end, until finally gangrene killed her, rotting her alive from the feet upwards. It's given me a terror of getting old and helpless. Please smother me with a pillow before I end up like that. If she had been a dog or a cat, we would have gone to a person for not putting her to sleep, but because she's human, she had to suffer, horribly, until they couldn't keep her alive any longer." Library Lulu said, "My mother had a series of strokes that left her almost totally paralyzed other than her left hand. She had brain damage that meant she couldn't tell reality from dreams, so a nightmare would become real to her, leaving her terrorized for days. She was also blind and nearly totally deaf. She suffered like that for years, getting great care, being fed boiled dog food, crying and begging for it to end, until finally gangrene killed her, rotting her alive from the feet upwards. It's given me a terror of getting old and helpless. Please smother me with a pillow before I end up like that. If she had been a dog or a cat, we would have gone to a person for not putting her to sleep, but because she's human, She had to suffer, horribly, until they couldn't keep her alive any longer. Raincoats George said, I've worked with hundreds of dying patients at this point. I've seen suffering that is incomprehensible. There is literally no bottom to what a human can go through. It is endless and all-consuming. What's worse is in the hospital we have become quite proficient at prolonging suffering. If family members want their loved ones to keep going because they cannot accept their impending death, our hands are almost always tied. Do everything. So we do. We shove tubes and drains in every hole. You lie in agony for days, weeks, months, years. Your body can be kept alive long past its expiration date. It will literally start to rot, but you can prolong the function of vital organs, and so that person must remain trapped in a meat prison. The end is always the same, it just takes longer. It is more horrific than anything you can imagine. All because Western cultures cannot face death collectively and often exist in a state of denial about it. Furthermore, often loved ones feel if they are the ones to say stop, they're killing their loved ones. Others get concerned about the religious implications, as if some great deity would cast judgment on them for not keeping their family member in a state of purgatory for as long as possible. So to answer your question, after years of taking part in that, yes, I support euthanasia. I think our threshold for its use should be very low. I see death as an inevitable part of life, and one of my greatest joys is being able to help someone pass without pain and in peace with their dignity. Anyone who says otherwise can come hang out in the ICU for a few weeks. They can change the dressings. They can look these people in the eye and tell them this must continue, that some arbitrary bullshit rationale is good enough to keep this going. The Quacking Duck said, I am for it. For those against, maybe having two MDs sign off on the documentation that the patient is terminal and is aware of the decision they are making. Another rule should be once this patient makes this decision and a legal document is signed, that the family cannot override the patient's wishes, like what we see with DNRs, that family can override the patient's wishes and have CPR started. As a nurse, we have to change what we are doing. Keeping someone alive when they are gone from dementia is just wrong, period. The patient and families deserve compassion and a quick end rather than the prolonged nightmare that dementia brings. Antelliton said, I'm a nurse and I've seen people die long deaths, from cancer, dementia, old age, etc., and I think assisted medical death is something that needs to be developed and made available. But, I've also seen people with a death sentence, turning down the doctor's proposition to, for example, not treat it cold because it could speed up death and reduce their suffering. These patients are terrified, especially of dying. Still, they are aware of their suffering and the suffering of their families. And I think it's important to acknowledge that medical-assisted death can bring an enormous pressure on people to choose death, and we should ask if it is right and good to give people the freedom of choice in death as well. Having complete control over everything is not necessarily only good. And once you have the opportunity to choose death, it is also your responsibility to choose, with all its consequences. It looks like an obvious question when considering all the other comments of people who want it, and I respect and also agree with you. But it is important to also consider all the other values and problems it will bring forth. It is not a simple question in all cases. Rama Raisin said, I've always been for people to be free to make their own informed choices about how they want to live, or not live in this case. But it's not as simple as what one person says they want. We have to be really sure that the person deciding is not being coerced, that they are of sound mind, and that it is a choice that is persistent. That is, they will not change their minds later on. There's also the point of whether we should put a burden on the physicians or medical staff to go against what they may have swore an oath to, which is to do no harm. I personally agree with the notion that helping people legitimately seeking medically assisted death is doing the least harm, but I can see why some people might not agree. And it's easy to say from the outside what one should do, but I'm sure if you're a medical professional lawfully bound to help people die against your own beliefs, it can take a toll on your mental health. Luckily, I think most places that allow it legally have pretty good structures in place to facilitate these issues. But no system is perfect, and some people just might not want the risk of one person dying against their will when people think that it might be their decision, even if it means thousands others can die on their own terms. I was volunteering in a hospice and had my first encounter with a patient seeking medical assistance and dying a few years ago. She was one of the patients I connected the most with. We shared a lot of conversations about her life, her love for old movies, and ultimately why she decided to pursue a death on her terms. She was going to keep it from her children, But I was happy to hear that in the end her children were with her on the day of, and I will always remember her and how at peace she was when a date was set. Madame de Merteuil said. My grandma was 89 and wasn't dying of anything in particular. She didn't have cancer or dementia or anything, but her memory was slowly failing and her body was generally falling apart from old age and a leg injury from 50 years prior. She had been a widow for 14 years. She was lonely and in pain all the time, and her family lived across the ocean, so we couldn't see her as much as we'd want to. There was nothing actively killing her, but she did not want to be alive anymore. She wasn't depressed, just old and in pain and ready to be done. She was able to go to a place in Switzerland, with all 4 of her children, and take a pill to end her life while her children sang to her and she looked out at the mountains. We all got to say goodbye to her and she got to be completely in control of the end of her life. I can only hope that if I am ever in that situation, then world will be kind enough to let me close my own exit as beautifully and peacefully as my grandma did.